Autism spectrum disorders, or ASD, are a diverse group of conditions that are characterized by some degree of difficulty with social interaction and communication. Other characteristics are atypical patterns of activities and behaviours, such as difficulty with transition from one activity to another, a focus on details, and unusual reactions to sensations. The abilities and needs of autistic people vary and can evolve over time. While some people with autism can live independently, others have severe disabilities and require lifelong care and support. Autism often has an impact on education and employment opportunities, and April is Autism Month. And to help us understand and unpack it, we are joined by Healthspan Physician Dr. Michael Mole and Letlhodilwe Mahlangu, who is a parent to an autistic child. It's so good to have both of you. Thank you very, very much for joining us here on Morning Live.
Thanks for having us, Leanne. Wow. I certainly feel like I'm standing in Plan B here when we have a parent on board. So
yeah, indeed, it's always nice. And Letlhodilwe, we're looking forward to hearing from your first-hand experience on all of this. But let me start with the medical side of things first. I mean, I'm realizing that there's a massive spectrum of autism, and the symptoms may vary. And perhaps maybe you can talk to us about that, Michael, in terms of what to look out for when these start developing, all of those kind of things.
Sure. Yeah, and so it's a great question. And there's a lot of misunderstanding around autism, or as you described, autism spectrum disorder. It's a neurodevelopmental condition, which just means that the brain develops differently. It affects how someone communicates, how they process information, and how they interact socially. I think it's important, though, to know that autism doesn't mean you have, or being autistic doesn't mean you have an illness or disease. It just means your brain works differently from other people. It's not a medical condition with treatments or a cure. In fact, as we described it, autism spectrum disorder, that's what medical texts describe it as. But some people find it to be a little inaccurate or even offensive because everyone's brain is different. So a better approach might be neurodiversity, which really views autism as a natural variation in people. Autism is something you're born with, and if you're autistic for your whole life. And Leanne, you mentioned it right at the beginning. It's a spectrum, and that's so true. So it means one person could be non-verbal and need daily support, while another could be a tech genius who just struggles with social cues. No two autistic people are the same, and that's part of the beauty and the complexity of autism.
Yeah.
But probably, and I'll wrap with this, is in the past, people often saw or thought of the spectrum as a straight line between you're either more or less autistic. But today we understand that that's wrong. The spectrum really means that autistic people have a unique combination of characteristics, and they're very different to one another with different sets of strengths and challenges. So it's not a straight line. It's a complex mix of strengths and challenges.
Yeah, it really does sound like it. There's so many things to look out for. So, Letlhodilwe, let's talk to you, because you obviously you've lived this reality, and your son has autism. Perhaps what were the early signs? What made the alarm bells ring for you?
At first, thank you, Leanne, for having me here. At first, I didn't know what autism was because of the lack of education there is. I had a family friend who knew what autism was. She came to me and said she thinks my son is autistic. I didn't know what that was, bearing in mind my dad is a psychiatrist and my mom is a nurse. And they also didn't really know much about autism. And then my son got sick, had pneumonia. I took him to a doctor and I asked the doctor, do you think my son is autistic? And he said, no, let's just get your son being sick first. Let's get that out of the way. And then we would look into that. He was very quiet. He was a quiet child. He didn't really make sounds. He didn't have any lack of speech whatsoever. No eye contact. Didn't socialize with other people. Liked his gadgets. He liked the Nintendo DS Switch. He became very good with gadgets at a young age. So those were my first signs. And then he was diagnosed by Dr. Riesel.
Yeah, yeah. I mean, that must have been, it's never easy to hear this, because that's a journey that you embark for a lifetime. I suppose as a parent, you know, your reaction to this, and how did it feel hearing this news?
I think I was so confused. I was so overwhelmed. I didn't even know. I got anxious. They put me on meds because I started reading up about it.
Yeah.
And as I started reading up about it, I remember, because my son was admitted at the hospital, there was a lady sitting opposite, well, with their son, and she just came to me. I just started crying, and she just came and she just hugged me. And I'm like, they say my son's going to be autistic, and from what I'm reading, he's never going to talk. And she was very understanding. I think she knew better about autism, and we just started having a chat at the hospital.
Yeah.
Yes, and then when my son was put on meds, that's when I started seeing. I think he was put on Risnia or something, and then as he started having eye contact, that was actually the first time my son and I actually had eye contact, and it was different.
Yeah. How old is your son now, by the way?
He's 16,
He's 16.
so I've lived quite a journey.
Okay, and I'm going to ask you a bit more about that. Michael, I mean, this is, you know, as you mentioned, you know, it's not the same for everybody, and everybody has their own story to tell when it comes to autism, and it's never an easy story. It isn't. I mean, it's a very, very tough thing. But you say that people are born with autism, but what causes it? What is it? I mean, is it genetic, or is it in pregnancy? What happens?
Leanne, we don't know. So there is a genetic component, but what we do know is that it's not caused by bad parenting. So, I mean, seems like a silly statement to make, but it really is important. It's not caused by vaccines. Man, the MMR vaccine and the link to autism has been a myth that's been going for way too long. It's been debunked. The doctor who cited that study has been scrapped off the roll. He had his license revoked. It was falsified data, and there are dozens of studies that have followed up to show there is no link between vaccines and autism. So you can put that to bed, put in a rocket, send it to the sun. It's not linked to diet, it's not an infection that can spread to other people, but we don't know.
Yeah.
So the cause is unfortunately unsure.
Yeah, cause is unsure, but the treatment is there, and that is, you know, that what we heard. I mean, just hearing Claudie talk about first making eye contact with her child, I mean, it's a big deal. I mean, I remember my children staring me in the eyes, and that was just the best. But if your child is not, I mean, then you need to look into this. So the treatment options available, Michael?
So the understanding of autism has changed over the years. It's not about it's not about broken brain wiring, it's different brain wiring. So we see ADHD, or rather autism, overlapping with ADHD and anxiety. There's a whole lot of complexities that come with together with autism. And I think some of the challenges more than treatment, because treatment, there's medication, but we're just wary of treating it to cure it. We don't want to cure autism. We want people or boys or girls with autism to experience and live their best lives, and whatever that means in terms of sort of sensory deprived rooms, for example, noise cancelling earphones, when they don't give eye contact. So it's not seen as rudeness, it's regulation. So it's more from a parent's perspective really hard, but from a community perspective, it's awareness and it's understanding. You know, there's so much we can do as a community that is not autistic for autistic people by accepting them, and not just being aware of it, but actually accepting that they're different to us. Don't need to be cured, don't need to be treated and managed. They're different. Their brains are wired different. And I think that's probably from a public awareness perspective key, that we get that right.
Yeah.
Treatment is unique to every child. As we said right at the beginning, autism is unique from child to child. It's not a standard diagnosis. It's different.
Yeah. So, Claudie, let me come to you, because, you know, you've had 16 years of this. I believe you've actually started an NPO in Bloemfontein that you probably, you know, create awareness, such as interviews as you're doing right now, and helping other parents, because it is daunting. It is a daunting world, and yet there is hope out there. But the big problem I imagine as well is schooling, because this is where problems come in, the waiting lists are too long, and there are not enough options. But perhaps you want to talk about how you've managed it.
So my son was diagnosed at an early age. He was 1.5. So for me, my journey started there. I started doing autism advocacy. I started advocating for schools because there were no schools. Doing all the research that I was doing, there were no schools in the Free State, and realizing that at the time there were no schools. And then move. So sorry, that is my son.
Oh man.
So it is easier. So at the time,
he can, you know what?
So at the time,
he can come in. Don't worry about it. Let him come and wave and say hi to us. I mean, we're talking about him. And there we go. Hello, my boy. Hello. Hi. You're on TV.
Hello.
Oh, my sweetheart. Oh, that's beautiful.
So at the time I was doing the autism advocacy. I started doing door to door, and I even moved from autism to severe disabilities. And then actually I've been doing autism advocacy for the past 15 years. That more recently, they even with that, I got a school opened here in the Free State. I got the government to open a school in the Free State, which is the first autism school in the Free State. So, but then it became late for my son because the journey of looking for a school, and they said he's severe, and then, oh no, he's not potty trained. And then there was just so many things coming. So we just decided to take him to a daycare center. And now that the school is open, it was too late for him. But more recently, then they said, no, you cannot advocate for a school and not get admitted. So your child will be the oldest at the school. So the journey of the school has been, it was bad. Also with therapies. Doing research in your rural areas and your informal settlement, we don't have therapies. There's no medication. So you find that in these areas that there's a lot of kids that are more struggling than in anywhere else, especially in our rural areas. Yeah. It has become so bad that parents have just given up. More so, there's more street kids that are disabled, that have autism than anything else.
Oh, Claudia, I'd like to ask a question, if I may, Leanne,
sure,
because I think raised a huge issue. It's around misunderstanding, it's around stigma, it's around cultural beliefs. I mean, disabilities are often associated with curses and ancestral punishment, and it's just so what you're doing is amazing work to eradicate some of that and just break the stigma, because it must be so hard in this country particularly. I mean, we've got a shortage of specialists. There are long waiting lists, and there's financial barriers and limited access to service. And I mean, there's all of that. And as you mentioned, lack of training in the education system. But for me, it's the stigma and the cultural beliefs that are a real barrier to care.
Yeah, guys.
Yes, they say that we are cursed.
Yeah, we are. I'm going to have to pick this conversation up in the month, because I mean, we're already out of time. I got to say goodbye to both of you, but please, if we do call on you again, please accept our invitation, because this conversation is one that's desperately needed. Dr. Mol and Claudia, thank you. Thanks so much to both of you for your time.